Hello, and welcome to Ask Dr. Dora. I'm Dr. Dora Dixie, board certified in family medicine and addiction medicine. Ask Dr. Dora is my virtual medical ministry that will be used to share knowledge about the magnificent bodies we live in. I believe that knowledge is power, and the more knowledge we have about how the body functions, the better care we can give it for improved and hopefully optimal health. Did you know that alcohol can cause birth defects if pregnant women drink? Because alcohol is a teratogen. Teratogens are environmental agents that impact the normal development of an embryo or fetus. The continuum of alcohol-related birth defects is called fetal alcohol syndrome or spectrum. Factors that determine the severity of the birth defects are maternal genetics and metabolism, the quantity consumed and when during the pregnancy. Drinking in the first 8 weeks of pregnancy results in more damage. You may ask how much is too much or how much is safe to drink during pregnancy. The answer is there is no safe amount to drink while pregnant. It is a misconception that the placenta protects the fetus. When a pregnant woman drinks, the baby is drinking as well because they share one blood supply. The developing baby's liver is immature and cannot metabolize the alcohol efficiently. Keep in mind that the body perceives alcohol as a poison, so the baby is being poisoned, increasing the risk of miscarriage and stillbirth. People born with fetal alcohol syndrome have characteristic features. These children have growth retardation before and after birth. These people have a small head, small eyes, a flat midface, or no prominent cheekbones, flat nasal bridge, short nose, thin upper lip, an indistinct philtrum. And this is the philtrum, this little divot on your top lip. To be inclusive, a 2014 Yale School of Medicine study reported that low-level drinking in pregnancy is not associated with a higher risk of poor birth outcomes. In that study, low level was defined as only 1 glass of wine a week. A 20-year study out of Baylor University in Waco, Texas, reported that older Black women with multiple previous pregnancies who drank beer were more likely to have a baby born with fetal alcohol syndrome. A literature review of 42 eligible studies researching the reasons why women from 16 countries drink during pregnancy revealed that the most commonly reported reason of alcohol use in pregnancy were social pressure and the belief that only strong alcohol and alcohol in large quantities is harmful. Other reasons were a lack of awareness of adverse effects on the fetus, coping with adverse life experiences, influenced by personal experiences, peer pressure, and intimate partner pressure, belief in the beneficial properties of alcohol, advice from medical practitioners that it's okay to drink a little if the pregnancy was unwanted or unplanned. And some women have alcohol dependence before they get pregnant and continue to drink. And there is consumption as a cultural and traditional custom. Ray Charles was on to something in his song, Let's Get Stoned. And it goes like, let me tell you one more thing. Ain't no harm to have a little taste, but don't lose your cool and start messing up the man's place. Ain't no harm to take a little nip, but don't fall down and bust your lip. let's go get stoned. Moderation in all things is one of Ask Dr. Dora's mottos. Remember, the developmental delay that accompanies fetal alcohol syndrome or spectrum is 100% preventable. If you like what I'm saying and want to learn more, show your support by liking and subscribing to Ask Dr. Dora on all social media platforms. Thank you for supporting Ask Dr. Dora, and tune in again for information on treatment options for alcohol use disorder. Thank you.